One of the biggest contributors to stroke is high blood pressure. In fact, in this article, they state that proper management of blood pressure is a cornerstone of stroke prevention and acute treatment. Hypertension is common and has a high attributable risk for stroke, in fact, 25 to 50%, and both clinical trials and observational studies have shown a reduction in the risk of first and recurrent stroke by simply lowering one's blood pressure. Let's first talk about how blood pressure is even calculated. I take blood pressure, bilateral blood pressure actually, on every single patient. And in the event that it is either high or low, I'll ask the patient, do you know how blood pressure is actually calculated? And surprise, surprise, most have no idea. I find this very interesting when dealing with patients who have known issues when it comes to regulating their blood pressure. For example, if you have high blood pressure and you're already on blood pressure medication, maybe I'm just different, but I would want to know, how does this thing actually work from the patient side? But also from the provider side, I would want my patient to know how that thing actually works. We have just been taught to believe that this high blood pressure thing is something that's bad, and so when a doctor says that we need to take this medication in order to lower it, we just do it. Blood pressure has to do with the actual amount of pressure that's within your blood vessels, and that is mediated through your blood vessels' ability to constrict or dilate. You need to have a certain amount of pressure in that tube in order to perfuse your body with blood. It's kind of like Goldilocks and the Three Bears. We don't want too much or too little. We want it to be just right. If my vessels are excessively dilated, there won't be a whole lot of pressure within that tube, and you could think about it kind of like just throwing a bucket of water up in the air. Now compare that to if my vessels are excessively constricted. It's like whenever you place your finger partially over the end of the water hose. There's less space for that water to come out, which will increase the pressure within that tube and allow it to spray further. Now you can probably already see how that would lead to some issues in regards to cerebral blood flow, aka blood flow within the brain, but let's talk about what actually happens with high blood pressure and how that can lead to a stroke. In this paper, they discuss how there are several mechanisms traditionally involved in the pathogenesis of hypertensive cerebral damage, including cerebral blood flow autoregulation, endothelial and mitochondrial dysfunction, and oxidative stress. Let's break down each one of these, starting off with cerebral blood flow autoregulation. Cerebral is just a fancy word that they use for brain, so what they're referring to is a process that regulates and maintains said blood flow to the brain. Autoregulation is impaired when blood pressure exceeds the compensatory vasoconstrictor or vasodilatory capacity, and that this event usually occurs when the average blood pressure falls below 50 millimeters of mercury or rises above 150 millimeters of mercury. So what they're saying is that a blood vessel can only widen or dilate so far and can only constrict down so far. And if, for example, my vessels are already wide open, but my heart rate continues ramping up even higher, the pressure within my vessels will probably build and in turn lead to a reduction in the amount of cerebral blood flow. If the tube is smaller, less blood can get through as compared to if that tube were bigger. Next up, we have endothelial dysfunction and oxidative stress. What is the endothelium? The endothelium is composed of a single layer of cells that covers the internal surface of the blood vessels. It is considered a dynamic organ that acts as a natural barrier between the blood and the vessel wall and has a wide variety of roles in controlling vascular function. So, these are the cells that coat the inner lining of a blood vessel and what modulate the diameter of that vessel. The term endothelium dysfunction identifies the transition from a normal to a damaged endothelium that can express itself as pro-inflammatory, constricting, proliferative, and procoagulative phenotype. So as pressure within your vessels increases, it leads to damage of the inner walls, aka endothelium, of your blood vessels, leading to plaquing and clots and inflammation, etc. Let's go back to the analogy of putting your finger over the end of the hose. If the water is up high enough and I put my finger over the end of that hose, my finger may get tore up a little bit, especially if I do it for a while. Same thing applies to the inner lining of your vessels. As the blood rushes across the wall of your blood vessels, it tears it up, and it can lead to plaquing. Once the inner lining of that blood vessel has become damaged, fatty deposits and other substances within your blood begin to accumulate, which leads to narrowing of your blood vessel. The inner wall of that blood vessel thickens, making the tube even more narrow, and what's going to happen as that tube gets more narrow is that the blood pressure will rise even higher. Then from there, the endothelium dysfunction is accompanied by an increased production in nitric oxide, supported by alterations in nitric oxide metabolism and with a consequent increase in oxidative stress. So breaking down the endothelium, because high blood pressure and the shearing that takes place as the blood rubs across the inner lining of your vessels leads to an increase in oxidative stress. I know we're using a lot of big words, but I think they're important for the context of this video. So what is oxidative stress? Oxidative stress is a condition in which reactive oxygen species production exceeds the capacity of the antioxidant defense system. Now, breaking that down, all of the cells within your body are producing things, beneficial things, and they are also producing waste. Just like how whenever you eat something, it fuels your body, and then you have to dispose the rest as waste. Your cells just get a fancy name for their waste, that being reactive oxygen species. Now, when reactive oxygen species are either too high or your antioxidant levels are too low, that leads to oxidative stress. Think about it kind of like fire and water. If there's a big house fire and all you have is a small bucket of water, probably not going to do much. But on the contrary, if I have a small campfire and a fire truck, that fire doesn't stand a chance. So we want to have high levels of antioxidants and low levels of reactive oxygen species in order to mitigate the likelihood of oxidative stress. And lastly, when we tie this concept of oxidative stress into the mitochondria are cells within your body that produce energy. And when we are discussing the ability for your blood vessels to constrict and dilate as necessary, that process will require energy. Why this is important is because in the event that there's a decrease in my mitochondrial output of energy, that will lead to an inability to power my blood vessels. So what would cause an impairment in my mitochondrial ability to make energy? Well, in this paper, they state that overproduction of reactive oxygen species by the respiratory chain of brain mitochondria can progressively impair mitochondrial energy metabolism and hypertension. So more reactive oxygen species is not good for our mitochondria because remember, we need to have healthy levels of antioxidants in order to quench that reactive oxygen species. In the event that we do not have that reactive oxygen species will in turn go and bind to the mitochondria and destroy the entire thing. And as you can imagine, if you get rid of the thing that makes the energy, there will be less energy. And if there's less energy, the things that need that energy will become dysfunctional. I want you to stay tuned for future videos when we discuss non-pharmaceutical applications that you can use to manage your blood pressure.